Hi guys, we're going to talk to you today about doing some controlled articular rotations or CARs for pregnancy. So the whole idea with controlled articular rotations is that you're really expanding your range of motion and gaining strength at the same time. So ultimately you're making those joints move better. And during pregnancy you have some relaxant in your system, so you might feel kind of loose or you might feel like overly tight in some areas, but that doesn't mean that you can't still work your joints and make sure that they are strong and protected. One of the areas that a lot of pregnant women start feeling really tight is actually in their neck and shoulders. Got a little more of this going on, a little more of this happening, and then before you know it, you're kind of starting to be pulled forward, or you're leaning back to compensate, and that causes a rounding in the shoulders as well. So one of the things that we like to start with is neck. We move from the neck to the shoulder girdle, and then we move from there into the spine. So starting off, you're going to take your head in a nice big circle. I want you to find the stretch as you come around. And for pregnancy, I'd like you to start at about 60% of your maximum push. So as you come around, you're pushing about 60% of your max, so that you're not pushing through any pain, and you're building some strength, but you're more seeking out what's happening there. I don't want anybody to go right into a big push. So 3 times in one direction, 3 times in the other direction. Coming around, and then moving into the shoulder blades. You'll pull your shoulders up to your ears, pinch them together behind your back, pull them down the spine, and then open them up. I'll show you from the side there here. Up, squeeze, again, squeezing about 60%, and open. If all that feels good, you can ramp this up to 80 or 90, that's fine. And now for the spine. If you have been diagnosed with a diastasis recti or a separation here of your abdominals, or you feel like you might have a separation here, I don't want you to do any extension, so I'll show the modification there. You're gonna wrap yourself up, round your back, twist, side bend, extend, except if you have DR, side bend, twist, and come around. And then the other direction. All the way around. Your hips are nice and stable. You're not letting this happen while you're moving the chest. Now, if you do have a separation there, it'll just look like this. Round, twist, side bend, and then come back around. That'll still probably feel really good, opening up all of these muscles through the rib cage and back. If you have any questions, make sure that you hit us up and ask us, so that you know the best exercises that you can be doing to improve your range and keep you safe during pregnancy and after.